We are here with the renowned Julia Hunter from Skin Therapy. She's the lady that I have talked about the most in terms of products because I first found.
Thank you.
I first found
I'm
you.
honoured.
Oh, well, it's we met once before this, so I'm so excited today. It's like I'm a little child. And when I first came across Julia Hunter's products, my skin had been just not behaving great. I was trying many things, and I went to a clinic where they had some of your products, and this woman started using them on me, and I thought, this is great. I love the fact they're clean, they're chirally correct, which we're going to go into later, and it's a lot about how things will actually work in your body, and that your philosophy, because she has a website which is much better now, but for those of you who follow me who went to see her website first, it was like so old-fashioned, and
My website people are melting down right now as you say
so
this.
old-fashioned, and there was these films from you, and what really drew me to you, Julia, is I listened to your films talking about stuff,
Right.
and I listened to your attitude towards skin, and it was just this love affair you have with skin, with great skin.
It
You know,
is.
there's some dermatologists who are dermatologists and they're mechanical, but
Exactly.
your passion is staggering,
Right.
and I just love that, and,
Right.
and I think that's because
Well, and
you're
my passion to make people healthy, look as good as possible, and it makes them happier. And for
Yes.
me, at the end of the day, I mean, look, what are we supposed to do for each other?
Yeah.
But, I mean, that's a great gift. So,
It's-
yes, I'm passionate about my gift.
She's passionate about her gift, and it's also, so we're going to talk all Julia Hunter stuff today, but also I'm here with Julia because you said to me, come along and have a treatment.
Right.
Because Julia also does laser treatment, different things. So then Cecily sent us some pictures of me, up close and personal. All right, pictures of that little bit, you know.
Which
around
I
my-
needed to look
Yeah.
and see what your
What it's
skin,
like.
to figure out what's the best tool for your job.
Because this is more than the skincare today. This is you with your dermatologist hat on,
Right.
and some tools in your
Right.
hand. And I'm generally really comfortable with my face. It's taken me probably
you should
until
be.
I'm 50.
Yes,
You know, because I had
yes.
really bad skin till I was 30. I had
Right.
chronic acne. I
Right.
did Oractane for a year. I did a CO2 laser, the old-fashioned
Oh,
one,
yeah.
where you kind of, you know,
Oh,
when
yeah,
all
where
my,
you're
Yeah, I mean,
burned.
you're burned for a month,
Oh,
ladies. It's
yeah.
like, there's a CO2 mild laser now, but this was a different time. And I remember I wouldn't go out the house for 2 weeks, and I should have stayed in a month because I went round for walks
Yeah.
in my local community,
Yeah, yeah,
and they were
yeah.
like,
Exactly.
and I was like,
Yeah.
I'm so happy that my skin's
Yeah.
smoother.
Yeah.
So, you know, I then started really looking after my skin and getting into regimes, and then, you know, I discovered your regime, which is the only products that are consistently, because I try many products for people,
Right.
and there's some really old friends like Jan Marini's original
Exactly.
Siesta
Oh,
cream,
yeah.
which we
Oh,
loved,
yeah.
and then yours are always in there,
Right.
you know, and so
Well, I'm honored by that.
Well,
I
no,
worked
just
hard.
they are.
When I created those products, it was all about being physiologically correct. In other words,
Physiologically.
what I was trying to create was the non-toxic pharmaceutical strength alternative, okay?
Yeah.
So, and for people, because look, when I look at your
How
skin,
strong are your products? I want to know. Because I think
Well-
they're a bit stronger than what I'd be able to buy in a shop.
my products are professional strength,
Yeah.
okay? And they're such professional strength that the reason we're fastidious about giving people instructions about only use this much and do this and here's how you mix it and here's how you start and advance,
Yeah.
okay,
Yeah.
is because they are so strong, okay? Now, how strong are they? They are the pharmaceutical strength alternative,
Yeah.
non-toxic,
Yeah.
okay? Now, do I put some pharmaceuticals in there? Do I put pharmaceutical retin-A in there?
Yeah.
Yes. But I also made the cream that the retin-A goes into, which is the only non-toxic cream
How do you
on
def-
the market.
How do you define? Because living in an age where lots of people say, is this clean, is this organic? You know, sometimes I think because everything is made of a chemical,
Right.
if it's a natural chemical or not, the concept of saying is it organic can be blurred. So do you think it's better to be organic or to be clean? Because I think they're two different things.
Okay, so organic is good, okay, but strength is what gives you the results
Yeah.
that you're looking for, that makes people happy, that stops their acne, that decreases or you know, stops their acne, decreases their rosacea, decreases or makes disappear their enlarged pores,
Yeah.
their eczema, their psoriasis, their brown spots, etc. Okay,
Yeah.
so organic is good. Okay, organic is less toxic, but the problem with organic is something can be grown organically, but the soil has not been tested to see, is there DDT in it from years gone by?
Yeah.
Are there chemicals, as you go down the highway and there's organic farms on either side of the highway, and all these fumes are spraying down on
Those
whatever
crops, those organic
crops
crops,
or whatever is growing there, okay? It's so organic, you've got to understand that organic is not the be-all and end-all. Strength is what matters. Now, chemical is not bad if it's a non-toxic chemical. And one of the things that I put on the website was ingredients to avoid, okay? For instance, sodium lauryl sulfate, some of the ureas, propylene glycol, the parabens, the ones that we know. But what's happening in the industry today is they've just changed a little bit the chemical structure of things that are toxic. Has a different name. People don't recognize them. They're still, what does toxic mean? Toxic means inflammatory. And if inflammation is the cause of all disease and aging, brown spots, you want to avoid inflammation, okay? But inflammation, life is an inflammatory event. Stress is inflaming, okay? You are what you eat. You develop allergies as you go down the path of life, or sensitivities. You have genetic switches that turn on that inflame you. So what I say to people, and what my philosophy was when I formulated these products, okay, because I'm a little formulator by nature, is, look, you want the strength, okay, but you also do not want to spend your money and put on you day in and day out things that are increasing your demise, basically, or aging you because of the inflammation.
So what kind of things
So
would you
chirally
think do
correct,
that?
for instance,
Okay.
okay? So why did I do chirally correct? First of all, chirally correct are stronger. You've thrown out the 50% that's useless, okay, that's in there filling up space, basically, and you only have so much space in a formula or in a pill. And so you want to toss out what's useless or harmful, okay? There's a reason you use L-ascorbic acid or lipoic acid. I mean, there's a reason that you use L-lysine, because those are the chirally, chemically correct bits, okay? And what that means is that on your cells, there are little receptors on the outside of every cell. And so when you present the body with R-lipoic acid, it goes, oh, R-lipoic acid, okay? I know what to do with that. And it turns on a good function and not a bad function. Whereas if you present it with alpha-lipoic acid, it goes, it has a moment where it goes, okay, well, what do I do with this? Then it has to expend energy, which causes inflammation to a certain extent, to get rid of the 50% and to only then accept, like letting into your house, okay, somebody you know and not some stranger. And so it'll let in the R-lipoic. So with the skin products, when you do that, with every ingredient, that's what gives people the results. Okay, that also with sourcing of ingredients nowadays, and this is what the huge issue is in today's world, is most ingredients come from China. So
if you're using a big brand where it's mass, so it's Kiehl's or it's Vichy or it's all these, what percentage of active ingredients do you think women are really getting?
1% or less of what they're buying.
So the kind of, because
they can't make you have, with products like that, those are mass market, you can't have, it's like when you go to the spa, they never use products that really make,
because
they
there's
can't
so many
get
people who might have an allergy.
A result. I mean, they can't, look, your skin gets moisturized, it gets greased is what happens, okay? But it's not going to do anything that may make you red or may give you a little bit of peeling. Those are where active ingredients. Those are the ingredients that give you the results, okay? Those are the ingredients with your skin, which is thicker skin, which despite having CO2, which is just a controlled burn, just like they go in the forest and burn off a certain amount.
Controlled forest burn on my face.
A controlled burn, okay? Despite that, your skin still looks fabulous and it's still thick, okay? So if you don't put active ingredients on your skin, then you're just wasting your time and money. And it'll get thicker, you'll get fine lines, it gets more wrinkled, especially thicker area here, which is more vascular. Okay?
So when you say thick skin, you're not saying it to flatter me. You're saying I have thicker skin.
Well, thick skin has an upside and a downside, like everything.
All right.
Okay?
So let's talk about, because we're jumping around. Are there questions yet?
Lots of people just saying great information, makes a lot of
Such good
sense.
information. I just want to listen to Julia. I don't know about you, but I'm fascinated. And this is not for the people who, this is not the film for people who, when they're doing their weekly shop up, get whatever's on the supermarket shelf. This is for those of you obsessed with your skin and obsessed with what you're putting on it.
And knowledge is power.
It is.
Because if it's just like, know what you should be putting in your mouth, because people want to slow down the clock, never mind turn back the clock. Okay. And so you want science, not marketing. You want substance, as my friend here says, not packaging. Okay. And so what we're talking about here is what they need to use when they're shopping, okay, in order to make
the
smart,
right decision.
enlightened, informed decisions.
Do you think that because your products are expensive, and I know because you use the best active ingredients, but I have a lot of audience. I have some audience who can afford your things and buy them, and I have some in my audience who can't, but they still really want to do things well for their skin. So there are these companies like The Ordinary, the Inky List, all these companies that put one singular ingredient in their products and give you more of a knowledge of science, even though I think sometimes they confuse with science. You know, the alpha arbutin. Okay, well, what is that to the man and woman in the street?
Right.
Hard to understand. Vitamin C a bit easier to understand. But do you think those products work if people are, thinking I can't afford the, whatever, $38 to $200?
Let me just say that as increasingly, okay, my products, they're products that are just nothing but marketing and no science, which are in my price range now, and the reason my products cost what they cost, and I spent my money on what's in the bottle. I didn't spend it on expensive packaging.
I know, it's just the worst, shittiest packaging ever. Nothing's airtight. They're like things you got off the shelf for 50 cents, but the ingredients have gone in as being $50 worth.
But airtight, okay, is not what it's meant to be. Okay, part of what we did with packaging, it was based on a lot of years of experience of what worked for men, for teens, for women. Because remember, skin is skin, and I'm treating skin, whether it be male skin, teen skin,
any skin,
wherever you are on the path of life. And so a lot of this airless packaging is, again, marketing. It doesn't need to be airless.
But doesn't, I mean, a lot of people say to me, oh, Trinny, that vitamin C's gone off when it's changed colour. There's
if you
real
put some moisture in there,
then it will,
and it doesn't go off. What happens is, it's just, look, the reason I use a powdered vitamin C is because it's a 95% L-ascorbic, full of glutathione, which is another major antioxidant. And basically, if you get a little moisture in there, look, when you put it in your palm and you put it on, you're getting 95% L-ascorbic on your skin.
On your skin, I know, because I rub it in here to make my cheeks shiny with a tiny bit of serum.
And when you use a vitamin C that's in a liquid or a cream, it's a water-soluble vitamin. It's oxidized. So if it went in the bottle at 5%, airless or otherwise, it's degrading every minute. So your 5% becomes probably 0%, and all you're left with is an acidic product. Okay, so mine, it doesn't go off. You can't make, look, you could,
your powder can't go off.
You can't go off. You can just, people will get a little moisture in there and it'll turn a little orange because it activated with liquid the vitamin C. The vitamin C was then trying to do its thing and absorb. Okay, so maybe that little bit is not 95%, maybe it's now 90%, okay? But still, it's the strongest vitamin C on the market, and it doesn't go off, it's just that it'll turn a little orange. So the reason that I have those films that show people how, and have those spoons to put it in there, okay, is you spoon it in there, or you flick it in there, you flick it in there. I have people who flick too much, they put it back in there, it's still fine.
I always flick too much. Okay, I want to ask you something else. If you're
and more
watching,
is not better.
More is not better.
But this is the other
Okay,
thing.
I need to hear this actually, because I'm
this
always
is-
more is better.
okay,
How
more
many
is
of you
not
out there
better.
are more is better?
More is not
Because I
better.
am so that I'm like, why use one when you can use two dots?
Okay, but let me tell
Okay,
you why
tell
more
me,
is not
yeah,
better. Okay, because
yeah.
this is very
'Cause I really
important.
need to hear this.
Okay, more is not better because your receptors in your skin get saturated
Okay.
and they can accept more. Okay, so do you have some sitting in what's called the extracellular space, which sitting there waiting to get in? In other words, all the doors are filled with people going through, with
Okay.
vitamin C
Yeah.
going through. Okay,
Yeah.
so what happens is it just sits on the surface of the skin because the body can't absorb in more. So when I say do that little spoonful, that's all you need. And that's why those products, they last a lot
Yeah.
longer because more is not better.
Yeah.
Because you're wasting your money then because it can't get in and do its thing.
Okay, so I'm going to ask you because
That's why two
People-
squirts
Yeah,
is
can
zero.
we just
yeah,
go back?
yeah.
I think before we paused, we were talking about thick skin.
Yeah.
And I don't think we got to the end of what it actually
that's
means.
interesting. Yeah, let's go on
and
that,
the
because
difference.
I always felt. Okay, I'm going to throw some myths at you because these are things lots of people will have heard, and I just trust Julia more than anyone else on these
Right.
issues. So, there's thick skin and thin skin. When I was young, Julia, if you had a thick skin, it meant you had a plump, peaches and creamy. A black skin to me is a thick skin.
Oh, yeah, it's thick
you know,
skin.
and if you had a thin skin, you were kind of Scottish thin skin.
Right.
That was a kind of
Well,
tradition.
I've got thin skin.
Okay.
Okay.
So what? Because
You've
you
got thick
said.
skin.
So you said I have thick skin. I always thought I had thin skin, which is so. It's very nice to hear you say that. But then you said afterwards that thicker skin is something you sometimes don't want, like here. You mentioned that.
So there's an upside and downside to
Yeah.
everything. Okay. So thicker skin, gravity's got more to work on. There's weight. Okay.
Oh, so you can
thicker
take
skin.
drags.
But the good news is thicker skin has more collagen.
Yeah.
So it's if you've got springy collagen. In other words, if you pick up your skin
Yeah.
and it snaps back,
Yeah.
you've got good, thickly wound
Okay.
collagen.
I got to
which
say
you
my
do.
hands is not as good as my face.
No, but
it's
look at it
it's
springs
still
back immediately.
springing back a bit.
When you see people
Yeah.
who it slowly
Yeah.
goes back, okay, and so there are people who have loosely wound collagen. Remember, collagen is like a slinky. Remember the slinkies?
Yes, I remember looking
Okay.
at zoom.
And
zoom,
if you
zoom, zoom,
pulled
yeah.
it, if you stretched it too much, okay, it didn't zoom.
That's
okay?
true, it stopped working.
And so
Yeah.
there's some people who genetically have loosely wound collagen. They can have thick skin. Gravity's working on it. Then their skin is going to fall more. They're going to get jowls because your skin ages in a comma. Okay,
Ages
that's
in
why
the
you
comma,
get.
that's interesting,
Yeah,
'cause
it
I-
doesn't just go straight down.
Because I'm going to give you.
That's why you get
okay.
this.
So marionette mouth, which many women
And
talking about
jowls.
marionette mouth, they hate and jowls. So
Yeah.
we want 5 hours with her. But I was telling my audience the other day that I always felt, in terms of aesthetics for a woman looking in the mirror, you can see in Doctor's thing that comma.
Yeah.
That I think women either have a concern here or here.
Oh, yeah.
Okay, so for me, I don't have a concern here because I did
No.
Botox since I was 35, Julia,
Yeah.
because I was on telly
Yeah,
and I
yeah,
didn't
yeah,
want my
yeah,
forehead
yeah,
to
yeah.
move, and the secondary
Yeah.
thing was it didn't
Yeah,
move.
yeah.
But here around my mouth, where there's a thicker skin from acne
And it's more
scarring,
vascular.
and it's more. So what do you mean by vascular? When
In other
you're saying
words,
that?
look, you move your lips
Yes,
all the
it's
time.
more, yeah.
Okay, so for instance, when people use my peel, they'll say, "Oh, I peel a little bit around here."
Yeah.
Okay. Now, even though it's called peel, it's not. You're not meant to peel. Okay.
Yeah.
It's just melting the skin off your face, but because this is such a vascular area, it goes in there and it causes a more profound result.
Okay.
Well, you need a more profound result because look, people hold their stress in different places.
Yeah,
I mean,
yeah, a
people
lot of people,
age
yeah.
genetically. Look at your parents, number one, okay? Did they get bags under their eyes, okay?
Yeah.
Even Botox or no Botox, if you're meant to get bags, and this is thinner skin here, okay? So this skin is always, even in somebody who's got thicker skin, this skin is where always you're going to age faster. It takes longer to get a result. You have to do more because gravity, it doesn't have as much collagen here. This has more collagen, and people are going to hold their stress somewhere. They're going to hold it here.
Yeah.
They're going to hold it here.
Yeah.
They're going to hold it here, or they're going to hold it here. And sometimes, look, we'll Botox people here, and people forget to Botox here.
Yeah.
Okay? Look, people purse more as they go down the path of life. Why do we get these lines here? Okay? number one is our teeth are thinning, our gums are thinning, the muscles are thinning, the skin is thinning. It's not just about the skin, okay?
Yeah.
And so you
Because
begin
Julia
to see.
has a lot of. I mean, I was really interested in this. If we talk about teeth for a second, because I just wanted to zoom back. I would say you have kind of this unbelievably holistic approach for a dermatologist because you've got your skincare, but also you talk a lot about supplements. And I talk with a lovely man, one day I hope you meet, called Shabir, who's a phenomenal. He has Victoria Health, it's a company here, and they sell supplements.
Right.
You should sell them on that side, I
Yeah.
just have to say, because
Yeah.
you would love him,
Right,
and he's a
okay,
chemist,
right.
and he's
Yeah.
amazing. And you also do menopause a little
Right.
bit, and then also teeth. And I think teeth is really interesting and especially
It's
in England.
imperative
Okay, especially in England
yeah.
because we are just lazy about our teeth compared to our American cousins. And I know that for me, in terms of the structure of my mouth, a lot of people say, "Oh, did you have filler?" And I had my teeth here
Yeah.
enlarged, so I had a
Widen,
very
yeah.
narrow bridge. And they put bonding here because they were all cracking my teeth. So this is all bonding, but it did that also to my mouth. So it pushed
Widened
it
it,
out a bit,
yeah.
it widened it a bit, which for me I like. But tell me why
No, but
teeth.
that's very, because look, if you look at people as they age, their mouth collapses,
Yes, it does.
okay?
Yeah.
And you can't just put filler in people's mouths.
No.
Because then they get these big and not natural looking lips.
Yeah.
And what they're trying to do is compensate for their teeth thinning,
Yeah.
okay?
Yeah.
And so that's why a lot of that dentistry has become about reconstructing the mouth,
Yeah.
which is very anti-aging. But you have to be careful because, look, the teeth for health are imperative. Remember, every tooth, embryologically, when you're first being created in utero, every tooth and every organ develop from the same bud. And
Yeah.
so if the tooth is sick, the organ is sick. Okay?
So where the tooth is developing from the mouth organ.
the tooth and
it's-
the organs separate and move as the baby develops.
Yeah.
Okay, but they're still connected. And look, the homeopaths, the great old European, German, and Austrian
Yeah.
doctors
Yeah.
showed this years ago. But embryologically, there's a connection. There's a nerve connection that goes on forever. Okay, the body's talking to it. It talks to itself. Okay, it's just like cells talk to themselves. I just put an ingredient that makes the cells in the skin talk to each other better, communicate better, freer communications. Okay, it's just like
Giving the skin free community. I love this. I mean, it's so on its head that I love it because
Yes.
it's very. I don't know how you feel, ladies, but I understand that. I want my skin to talk to itself well. I want my teeth to talk
the
to
cells
the
because
rest
then they
of
work
the cells.
better. Yeah,
Okay.
and with your teeth, okay, what you have to be very careful about is if you've got a sick tooth, because I have people who come in and they have certain symptoms, and also oftentimes I have people who, for instance, are losing their hair. Okay, it can be because they've got abscesses from root canals. Okay, I have people who have rosacea.
Yeah,
Okay,
yeah.
and it can be from certain tooth issues. So keeping your teeth and gums healthy is
Is a
imperative
huge thing.
to
Yeah.
slowing down the clock. I mean, look, from health comes beauty, okay?
Yeah.
And
Yeah, I
if you're
totally
not
agree.
healthy,
Yeah.
you're
You're
going
not.
to age
Yeah.
more quickly. You're not going to be happy. You're not going to look good. You're not going to feel good. So you've got to look at the body as a whole. And in order to win, okay, in order to slow down the clock, in order to have as good a skin as genetically is possible for
Yeah.
you or technologically is possible
Yeah.
for you, okay, you've got to consider your teeth equally. Okay?
I love this. I love this. I mean, are you feeling it, ladies? Right now, we're discussing sugar. So, tell me.
poison.
Okay.
Is what it boils
I mean,
down
this
to.
is the worst thing because I am such a sugar addict, Juliet. So I really need to hear from you why. I mean, I know why now. Even I lie in bed and I eat a feast chocolate ice cream and I feel the inflammation in my ankle. I know that seeing Erica Schwartz, she said to me, Trinny, your pre-diabetes level is quite high. My father had diabetes.
Right.
Okay, so I've got these warnings that I really need to listen to why I shouldn't have sugar. So
Okay, so number one is this. When people have sugar cravings, usually their adrenals are low. They're stressed, okay?
Okay.
And who isn't stressed in today's world? But number 2 is one of the supplements that I made is called trichromium. And chromium, when your body releases insulin, okay, it needs chromium. If your chromium gets low, then you crave more sugar.
Yep.
Okay, so I give people chromium. Number 1 to help stop the sugar cravings. Number 2 is when people they need to have their hemoglobin A1C blood level done. Okay, never mind their fasting blood sugar. And when it's high, you need to be taking chromium. Okay. The other thing is, people should never go to bed and eat something sweet before you go to bed. The worst thing that you can do is
every night, dark chocolate bar, jelly, and feast chocolate
and
ice cream.
I mean, what happens when we're stressed? Our serotonin levels get low, and we crave sugar.
Yeah.
Okay, that's
Yeah.
part and parcel of the issue.
Yeah.
And so, but when you go to bed and your sugar goes up because you're eating, what you're doing is, because remember, at night, what happens is the body and the skin is repairing itself. The brain is clearing and repairing, okay?
Yeah.
So when you go to bed with a high blood sugar, you're poisoning and wrinkling your skin all night long. The body has to deal with that. And also,
This is
remember,
good vanity. Talk to my vanity head. Yes, talk to my
remember
vanity head.
that sugar, when you eat sugar, it turns to cholesterol, and in some people triglycerides. So you're running up
I
your
know my
cholesterol and
cholesterol, which I always
triglycerides.
had really low, has suddenly got.
Okay, and
yeah.
so that's part and parcel of what's happening. The other thing is your sugar level goes straight up, and you get a little bit more energetic. And at bedtime, that's not what you want to do. And then it plummets.
Yeah.
Okay, and that's when people get depressed. They feel bad, but most importantly, you are wrinkling your skin because your body hates high blood sugar. Okay, and what does it do? It attaches it to proteins, whether it be in the skin,
Yeah.
in your organs. So you're
So it depletes
aging
my
yourself
proteins.
internally and externally.
Mm.
Okay, and it can't get that sugar off. Okay, then it goes through your liver. What's happening to today's world, there's an epidemic of fatty liver, okay? Because the liver, the body is fermenting because you're feeding the fungus, okay? And look, we're all full of candida fungus in today's world.
Yeah.
You're feeding it, it ferments in your liver. So even if you don't drink, it's as if you're drinking a fifth a day.
Yeah.
So you're aging yourself, you're poisoning your enzymes, and it doesn't taste that good. What you do instead is you have a piece of apple, okay? I know it doesn't taste as good. Trust me, I know, okay? But if you're gonna have chocolate, look, a lot of
I have
blood
raw
type,
dark chocolate.
raw, dark, okay?
Yeah, I have raw dark chocolate.
And the
Halo
darker
bars,
the
delicious.
better.
I have
okay?
a raw dark chocolate every night like that.
Okay, but you should have a piece.
I know, but a piece. I mean, darling,
I know,
a piece is like
I
not
know.
enough. I mean, can I just say also, Julia, I take chromium with cinnamon. I take a supplement, chromium cinnamon. I mean, I don't
Right.
take it regularly. I need to take it really.
Okay, but the right
regularly.
dose, okay, is, look, the lowest dose is 500 micrograms
Okay.
per day.
Yeah.
The highest dose, and some people require that, people who are diabetic, pre-diabetic, is you should take 1,000 micrograms per day.
Right, so I
if
can
you don't
take
take the
more,
right
okay,
dose,
all right.
okay, you're not going
Fine.
to get the right effect because
Okay.
supplements are just like medications. You've got to take the right amount.
All right. You really believe supplements work, don't you?
Supplements absolutely work, and I will tell you to the point that, look, and I say this to people energetically, okay?
Yeah.
And that is, if you want to prevent brown spots, if you want to prevent little, skin tags, if you want to slow down the clock, whether it be how well your brain works so you can stay in the game as long as you want to work, okay? If you want to slow
That's
down
what
the
it
clock
is
as
for
far
me.
as
I
wrinkles,
want to stay in the game for as long as I want to work.
and that's supplementation. That's
Yeah.
antioxidants. More is better, but you got to know what to take. I see people come in with bags of things. They're redundant.
Yeah.
I mean, look, what do you need to be taking? What's after CBD and melatonin as the strongest antioxidants, then comes glutathione, then comes vitamin C, then comes R-lipoic. The other thing you take for your blood sugar is R-lipoic. Lowers your blood sugar,
Okay.
and it's a massive
Are you
antioxidant.
going to remember this to write all down?
Yeah, yeah.
So okay, so basically, sugar is, if you had to think of like the top 3 enemies of our well-being, outwardly and inwardly.
Health and beauty.
What would it be? It'd be sugar, sugar, and sugar.
Sugar. Yeah.
Would it be sugar and sun?
Sugar and gluten and sun.
Sugar, gluten, and sun. The 3 enemies.
The things we all love. But so when you say no to people, you always have to say, okay, but what's the alternative? Because
yes, what is the alternative?
We have to live in the world, okay? We have
me
to have some pleasure.
Give me the alternative.
Okay? So what do you eat? Okay, I mean, look, they're expensive, but the first thing that it's better to eat, the darker the fruits, the better. Okay, what would that be? Blueberries expensive, raspberries expensive.
Yeah.
Okay. But, so you eat apples. You don't eat the sweetest apples, okay? You eat Pink Ladies versus Fuji apples, okay? And you've got fabulous apples over here that, so you eat something and you eat the skin, okay? As well, you don't peel your apples, okay? You eat, look, some people are allergic to Asian pears. You eat red pears rather than green pears. You eat fresh fruits. The darker the better. Yellow peaches are better than white peaches. Why? They're less sweet. It's running up your sugar less. You eat the skin as well. You wash it, you eat the skin, okay? Because the fiber is binding the sweet. But your tongue gets the sweet.
Yeah, okay, but it's less damaging then because it's coming in.
It's less damaging, okay? So
anything else you can eat that feels good, that's sweet? Like cinnamon. I mean, a lot of people say cinnamon is a good substitute in coffee, a little bit of cinnamon. If you, because I will take,
so
I
then
will take
there's
fake sugar, like stevia.
Okay,
what do you think
stevia is
of stevia?
a better choice. Okay, stevia. Look, the tongue cannot tell the difference between artificial sweetener and stevia. It can only tell.
I can. When I have it.
It can only tell the difference in the amount of sweet. Okay.
Yeah.
Now with stevia, you can tell there's a little taste. Look, you can get some really good Peruvian raw stevias that are a better choice. Look, honey's raw honey is a better choice. Is it sweet? Is it running up your blood sugar? Is it increasing the amount of cholesterol and triglycerides that are made? Yes. But if you do a little bit, okay. So for instance, after dinner when people always want a dessert, okay, what do you do to fool the brain? You have a mint tea, okay, and then your brain is totally placated. It's about fooling your brain.
Why is a mint tea fooling my brain? A mint tea is saying to me, where's the dark chocolate bar?
Well, the mint tea satiates your brain. It satisfies that sweet craving, okay? But, so if you have a little piece of the dark chocolate, raw dark chocolate, it's better than eating the whole bar because you're running your blood sugar up more. The goal is to satisfy yourself. The goal is everything in moderation. I mean, it's just like I say to people, it's not that you should never eat bread, but save it. Look, I've got people who are allergic to everything, who've got diabetes, da-da-da. Do I say to them, yeah, you can have a croissant once a week, okay? But once a week. Okay. So you're not deprived.
Okay, so maybe at the weekend it's like a 5-2. All right.
Yeah.
Any questions?
Well, kind of sticking on the theme of what to eat, what not to eat, dairy and alcohol have come up a couple of times.
Oh, yeah, dairy and alcohol. Okay, so dairy and alcohol, okay? Number one is cow's milk is not good for anybody. Please, the dairy industry, don't come and shoot me.
Why do you feel that?
And the reason is because milk has the sweetest sweetener that exists on the face of the earth, galactose. And if you stop drinking it and then you have some, you'll taste how sweet it is.
Okay.
A lot of people are allergic to the protein in it. A lot of people.
Okay.
And what is that doing? Inflaming you and aging you, okay?
All right.
So, what's the alternative?
Yeah.
Goat is the one that we're most like goats, okay? So goat is nobody, virtually nobody, you never say nobody in medicine, but virtually nobody's allergic to goat. So if you want a piece of cheese or you want a yogurt, it's better to have goat.
I can't bear the taste of goat, just personally. I'm sure some people love goat cheese.
So number two,
goat.
Number two, the fallback position is sheep, okay? That's the second. So it's better to eat those than it is to eat cow's milk anything.
All right. What about these other trends of almond and oat?
Okay, so
and
in
those
your
milks?
milk,
coffee.
for instance, in your coffee,
Yeah.
okay. Look, remember, all those milks are carbs, and what do carbs do? They make you fat. They make
I know,
fat.
but we
they
want to have
increase-
life. We don't
Okay,
want to
so,
avoid all carbs.
Oat milk or almond milk, but make sure it's unsweetened. I mean, when I go in the coffee store, I say, wait, is that unsweetened? Okay. Look, there's hazelnut milk. O-type blood loves hazelnut. Some people don't like hazelnut, okay? So almond, all those things are fine. You should have a cappuccino rather than a latte because more milk is not better. I don't care what kind of milk it is. It's just, it's carbs,
Yeah.
okay? So, again, everything in moderation, okay? If you want to put something in it, remember you've already got carbs with the milk. So if you're sweetening things, you're better off using stevia, but still, the body can make fat from stevia. Okay? So
But it's
less
much better
sweet
than real sugar. I mean, I
is
used to
better.
have, okay.
The
For-
goal
okay.
is to wean people off of sweet.
So I had for 30 years 4 sugars in my tea. And so then I went to 3 Canderel in my
Yeah.
tea, which then people go, oh, Canderel, that's carcinogenic, da 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 da.
Yeah.
Stevia I sometimes do. But, you know, if I'm now
Well, you
down
better
to 2.
put a little honey.
A little honey, all right, fine.
Raw honey
Okay.
would be a better choice.
So sugar
a
to you-
healthier choice. It's
Yeah.
all about what are the healthier choices.
I
Okay,
know. And we
It's-
can get used. I know we can get used to some of the healthier choices. And I've got lots of ladies who we go on a mission together. So we say this week let's try doing this. So
Yeah.
we've done this so often. But listening to you, Julia, you know, this week I do feel I want to look at. Let me try and have a week of sugar alternative eating. I think that would be a nice commitment. I'm going to make that commitment to myself because I want the wake up call. Because also, Julia, this is the thing for me. It's like when a lot of people said to me the other day, because I started doing biodynamic hormones again,
Right,
and they said,
yeah.
oh, but you know, why do you, like, if you were fine before, because I was taking Sage Complex, Magnolia, Rhodiola,
Yeah.
and things like that,
Yeah.
why do you need to do it, you know? And I was like, because I don't want my body to tell me when I don't have any more energy anymore.
Right.
I want to tell my body when I don't need to use it anymore.
Right.
You know, and I kind of start a new business. I'm 55
Yeah,
now,
yeah.
but I start at 50. I want to feel when I have that energy of a 50-year-old. You know, that
Right.
well, not even to say what energy, but I just have that limitless
in the game,
energy
you can
that I'm
stay
in
in
the
the
game.
game.
And I
Yeah.
want to be in the game, and that's what fuels my
Right.
life. It's what
50
fuels
is
my
young.
body.
55 is
Exactly.
young. Okay.
So I think
We're
that
programmed to live to 125.
all these things we've heard today, and we've heard so much from Julia Hunter, is just fantastic. So if you are only joining now, we're discussing everything that holistically helps you to look and feel good. So I came this morning to meet Julia properly because I met her once before. She has wonderful skin therapy, skincare, and also a lot of interesting supplements and hormonal replacements or hormonal support things. So have a look at your site, which is
Julia T. Hunter, MD.
Julia T. Hunter, MD. All right, because it
.com.
is amazing, and on and off. Probably I've spoken more about your products than anyone else's. And now having met you, I literally want to leave now and think, let me throw everything else out and now just use Julie from now on, which I can't do because I always want
Yeah.
to test for other people and
Yeah,
also.
which is a good thing to do.
But it's like, to me, I have to say, Julia, your products are the benchmark by which I test others. I have to say that to you
I'm
because I
honoured that you
really
said
feel that because I know what goes in to your creating something and
yeah, and I mean, look, when I
But your
made those
packaging is so
products,
shit.
yeah, yeah, but you know what? The reason is you want packaging number one that does not lead you
you
to
need
the
to
product.
justify it. It's a
Yeah,
throwaway
yeah,
line.
yeah.
Okay. All right. So I'm just. So now I'm going to sign off on this one, and then we're going to go through and do this. But I want to sign off so this is clean, so we know we saved it, and then we're going to start a new one.
Right.
A new one, if you're still joining or just joined,
Yeah.
where we're going to talk about the thicker skin around and what we're going to do
Yeah.
about it. And we're actually going to have a treatment today also with Julia Hunter. So if you've got nothing else on your Sunday morning, stay tuned. Otherwise, it will be on the blog later. Now we're looking at Millie, and we're looking at your sort of relationship and you have with different treatments you do from the body in your
Right.
role purely as a clinical
Right.
dermatologist of laser, etc. So looking at areas, you know, of if I say to you, I mean, you could say to me which areas you think I need to do some work.
Well, but number one is, what I say to people is, because what I see is I look I mean, look, I'm an observer by nature, not
Yeah.
by choice,
Yeah.
okay?
Yeah.
And so I look at the whole face, and, I look at the asymmetries. I look at what I see
Yeah.
as the areas that are your cross to bear, as I like
Yeah.
to say, okay? And genetically how you're aging,
Mhm.
okay? And, but then, the first thing you always say to people is, what bothers you the most?
Yeah.
Okay. I usually give people a mirror
Yeah.
and say,
Okay.
okay, what do you hate?
Okay.
Okay.
So, oh my God, that's a mirror with a lot of my. That's really unfair, Julia. This is like got so much. What is it when it makes it bigger? Okay. So I'll tell you what I probably think is that it's more lower than upper, and because I had acne from 13 to 30, so I had acne for 13 years.
Yeah.
And I pick my spots a lot. Close up and personal on here, I have what I call pebble chin. It's thick skin,
So it was
slightly
primarily,
separated.
your acne was primarily around your chin.
Around here and a little bit here.
Okay, so,
Okay.
P.S. Okay, what does
Yes.
that mean?
Yes,
You
what
have to
does it
look
mean?
at
Oh yeah, but Daisy.
where the acne, so
This is like the map I want to put on the site. This is excellent.
It's on my site.
Okay,
it's
this
there,
is
okay?
fantastic. So
Okay,
you're going to
so
tell us.
basically,
Can you see
when
this
you
close and
have,
personal?
I think so.
when you have issues in different places on your face, it helps us know what's inflamed. So you were primarily down here. Your
Yeah.
kidneys were inflamed. You were really inflamed, and
Yeah.
genetically, usually when people are allergic to gluten, etc.,
Yeah.
you were
Yeah.
doing all the gluten and sugar. Okay,
Yeah.
your liver. When you see people who have on their cheeks all sorts of acne, pimples, rosacea,
Yeah.
da da da,
Yeah.
their liver's inflamed.
That's
okay?
Chloe has had a bit. Yeah, I mean, I'm just talking about all the people I know. Like Lila, my daughter, has it all on her
Okay,
forehead.
that means her gut's inflamed. That's the small intestine. So
Okay.
she's eating foods that she's allergic to
yeah.
or sensitive to.
Yeah.
Okay, and so look, I mean, you look at what I say to teenagers when they come in and they've got pimples or enlarged pores or blackheads or whatever they've got. Okay, number one is, what's your mother allergic to? What's your father allergic to? Okay, because. And who you're more like, your mother or your father? Who do you look more like?
Yeah.
Who do you act more like?
Yeah.
Who do you hew more to? Okay,
Yeah.
so. Look, you were lucky you didn't get horrible pimples here,
Mm-hmm.
and you just got it here, okay? So if you got it around here,
Yeah.
okay, your kidneys were definitely inflamed. Yours was more small intestine. You were probably constipated.
Yeah,
okay?
I was. And also the lungs is important because I never breathed properly, and I had, as a child, I had
Asthma.
low blood cell count too. So they took me to
Yeah,
live in a
so
country
you
with
were-
lots of sea air and iodine.
Yeah. So
and,
you
yeah.
were allergic. Really, what it was is you were allergic. And as things pass out, the skin is a window to what's going on the inside.
Yeah.
Okay. So as things pass out of the body,
Mm-hmm.
the skin gets inflamed in certain areas. Okay. So it gives you insight into what the problem is. So if you're, for instance, eating something that you're allergic to, your gut's inflamed. You're inflaming your gut. All those inflammatory chemicals are emitted by the immune system. They go out, they travel all around the body, and how are they getting out? They're either getting out through your bowel movements
Yeah.
or through your urine, okay, or both. And you breathe them off to a certain extent, you sweat them out. How you handle things is genetically determined, okay?
Yeah.
So
So
basically,
my mother and brother had hemorrhoids, and I had
yeah,
hemorrhoids.
and so they're allergic
Yeah,
to
so
it,
it's
okay?
that whole-
So it's all
Can I ask you,
allergies.
in this, there's
By
a
the
lot
way,
of...
what do you put on the hemorrhoids? Organic lavender oil. It really helps.
Really?
Yeah.
Okay, great. Thank you very much. Good
There
to
you
know
go.
anyone else suffering.
Just in case.
Can I just say the difference? I see small and large intestine. So when you're looking at that as a spot, what's the difference of what's going on inside our body if our large or small intestine is inflamed?
Well, genetically, okay, usually what happens is when you eat foods that you're allergic to, or for people like A-type blood, genetically, historically lacks hydrochloric acid in their stomach, okay? So they're inflamed from top to bottom.
Yeah.
With you, genetically, your small intestine did not get as inflamed as it got into your large intestine, where it just sits there waiting to get out.
Yeah.
And
not getting
generally
out, and
what
it's not
happens
getting out.
is, if you're constipated, it's not getting out. But generally what happens is, from the large intestine, this is the other reason you don't want to be constipated.
Yeah.
There's this huge vascular loop that circles back to the liver.
So
and you suck the moisture. And so
liver.
part of why you want to drink water, eat olive oil, have things move out of there, okay? If you're A blood type loves aloe juice, good for the skin, helps cure constipation, okay? Is you don't want everything being, all the inflammatory and byproducts being sucked out of the colon, circulating through your liver, circulating through your body again, and just re-inflaming you.
Yeah.
And genetically, for whatever reason, okay, because there's only so much we know about genetics, this is where you demonstrated it rather than getting it all here and here. Normally it starts out here, okay? And this is the first hint. When you see teenagers who start here, and it's hard to get them to eat,
that's Lila.
do the right thing. A certain amount of cajoling that has to go on there. And so, but that's exactly what it is.
Yeah.
It's trying to, it's all about food.
Okay. I love that digression because that is just fascinating. I love that. Really, really interesting. Going back to now, residue. So I picked a lot, I created scar tissue, and then I did a CO2 laser to burn it off, and it did to an extent because it went from that to sort of softened. And around my mouth, probably because, as you say, I articulate a lot, and maybe the depth
and
here.
you may hold your stress here because I noticed in your photos. Okay, the first thing I noticed in your photos is that you had little lines here, and when I was taking your pictures, little lines here. One of the things that people do is they hold their stress here. We purse more as we go down the path of life.
I'm pursing more as I go down the path of life.
It's because you get this is where people hold their stress.
So I need to be doing
and
that.
you wake up. Well, the other thing is, I tell people, look, I've got all my patients, and I'm sure everybody thinks that they're a lunatic and I'm a lunatic, but I say to them, look, what is the antithesis of doing that? When you're driving down the road, okay, when you're walking down the street, smile. Okay, number one, it's better. People think you're a happier person, that it makes the world a better place. But also, what is it? You're anti-wrinkling. Okay, it's an easy thing to do. The other thing that's really good for that is microcurrent. Find somebody in your neighborhood who does microcurrent.
Yeah, I did.
Okay?
I did fractionated microcurrent.
Yeah.
I did that 2 and a bit weeks ago.
Yeah.
And she did that on me.
Yeah.
So she said if you do that once a month, that could help a bit.
Right.
A little bit.
Right.
See,
Well,
microcurrent.
so because it's pulling this out. Okay.
Yeah.
What at the end of the day do we do for this? Because at the end of the day, people want this gone.
Yeah.
Okay.
Okay.
So we put Botox here.
Do you?
Okay.
Okay.
Or we put Botox here.
I have
okay?
had Botox here with drop teabag.
You
Well, I've had it here like that.
Yeah.
This little scarring I've got is he tried something new where he got some peptides and he injected them very deep into my lines to build the proteins back again. So there, I think that
But
the
those
little
peptides
scar.
last for a millisecond.
Do you think?
Okay. Because look, peptides. Here's the thing.
So what am I going to do around this area then?
Well,
because I've got Miracle Blur, which all your customers should use if they need something.
And what's it called? Miracle Blow.
Miracle Blur, not blow.
Blur.
We're not giving you a
Miracle
blur.
Blur.
Miracle
Miracle Blur.
Literally, it's like polyfiller in England. There's something you have
Right.
in America similar, and it will just fill it in. So it's a temporary solution.
Yeah.
But it just fills in your lines.
Yeah.
And it fills in scars. It's fantastic.
Okay, so what do I do
But
for
long
these
term.
lines around the thing? Okay, the number one thing is I've got people recognizing that they hold their tension here. They're
Yes,
pursing.
but I'm talking about lip lines
Number
too.
one,
Yeah.
okay,
Yeah.
and pursing. The other thing I do is look. I have people using my peel around here.
So
okay?
the
because you
natural
want to
strength peel,
peel
yeah.
them down and
Yeah.
off. Retin-A, peel them
Yeah.
down and off.
Mhm.
Okay, because at the end of the day, especially with skin like yours that's thicker, you need more peeling.
Yeah,
okay?
I do, because I've got asbestos skin, Julia. I can take anything. I've done your peel. This is how I do your peel. So I put your peel on. I do microneedling
Every night.
I haven't recently, but
Okay, but
when
microneedle first.
Yes, but sorry.
Yeah.
I microneedle, I
Yeah.
peel, I do two doubling up. So
Yeah.
I do microneedle first, clean skin,
Yeah.
maximal cleanser, microneedle, then I put on the peel. Yeah.
Right.
And then it tingles
And
a bit.
put
I've
on
opened
a
the
couple of
channels.
layers, like 3 layers.
Yeah, okay.
Because basically more is better, and I can't make it any stronger and put it on the market.
Yeah. Okay.
Uh,
All
And
right.
so, but if you put on more layers,
It will be
it's stronger.
Yeah.
There is
Okay.
where more is better if your
Okay.
skin
On
will
the peel,
tolerate
yeah.
it. Okay.
So that's a kind of cosmetic at home solution.
And
But-
then the vitamin A plus, because the reason you want to use, and certainly at your age, you should be using Retin A. Okay?
I mean, should I use a tretinoin? Should I
You
use a
should
prescription
absolutely
tretinoin?
use a prescription tretinoin. Look, I've got my
So
patients at a
tretinoin
certain
is,
age.
just for people here, so there's many of you ask about what retinol they should use, and there's tons. There's the Dr. Elephant at Paula's Choice Cosmetics. There's many brands we all talk about. And they all have a small amount of a retinol palmitate or something. But
Well, retinol palmitate's it doesn't.
it doesn't really
it's
do
not-
much.
no.
No, I know, but for sensitive.
Yeah.
I mean, that's
And
what
it
some of
has
them
to
sell.
be in retinol has to be stabilized, okay,
Yeah.
in a liposome.
Yeah.
Otherwise, it's
Doesn't
degrading
work,
in
yeah.
the bottle. So,
So,
you've got to have a
if you're
strong retinol.
buying, if you really want to be doing retinol properly, is the solution to you that you go to your doctor and you say, can I have a prescription for some tretinoid, which is vitamin A?
There comes
Yeah.
a point, okay? So look, my vitamin A plus that I made
Yeah.
is the skin reacts to it like 0.5% tretinoin. Okay,
Oh,
it's
right,
stabilized,
Yeah.
and I have people using 3 squirts every night. They have to work up to that
Yeah.
because they'll peel like
Yeah.
with anything. Okay, and it's full of niacinamide, anti-inflammatory,
Yeah.
really good for any sort of pimples, whatever.
Yeah.
Okay, and for acne, it helps stop the production of pimples. Okay, it makes it really hard
Yeah.
because the reason you use a retinol, and then do they go to the doctor? Look, once you get to be 40, 45.
Yeah, like what age should you use a retinol? Because I
Yeah.
used retinol, I used a vitamin A cream, a tretinoid,
Yeah.
when I was 19. It was a gel, like different but
Yeah.
stronger,
Yeah.
to help with acne. Because
Yeah.
when you said it stops acne,
It makes
preventing
it
it,
hard
cleans
to
out
make
the
a pimple.
sebaceous glands,
Yeah.
and it does it.
Yeah.
So,
Because it's pushing the skin off the body. It penetrates more deeply. The
Yeah.
reason you use that is it penetrates more deeply, and you want to treat. I wish I had my skin chart. You want to treat the whole level, the whole thickness of
Yeah,
the skin as much as you
epidermis,
possibly
dermis,
can.
everything.
Okay, so a retinol, a strong retinol, okay, but Retin A, tretinoin, will penetrate more deeply. And what it does is it forces new collagen production. It's a push peel. It pushes the skin off, okay, which helps prevent skin cancers, helps get rid of old damage, scarring. Somebody
Yeah,
asked a question
age
about
spots,
scarring,
age
okay,
spots.
age spots,
Yeah.
etc. You've got to push it off as well as peel it off from the surface, as well as break it up with a vitamin C. Some of the ingredients that I have in there that are, heat-seeking missiles to brown spots.
Yeah.
But you've got to push it off as well. So I have people start. Look, you have to look at people's skin, but overall, if you're 45, you should be
Yeah.
using tretinoin,
I
a
use it-
prescription strength.
I use it in the summer. Do you think that's all right?
No problem. If
Yeah.
you're using, especially, you want to use one that's not inflammatory from
Yeah.
my point of
Yeah, yeah,
view.
yeah.
Okay, non-toxic, non-inflammatory. And it's when people overuse it that they
Yeah.
thin their skin. Okay, so
Yeah.
my patients use it. Look, I'm using my vitamin A plus because the skin reacts to it like 0.5%. Okay,
But night
then
regeneration.
I add. No, that's the vitamin A plus. Okay. Now, my night regeneration has
That's what
some
I'm saying, it's a
retinol in it.
combination.
My peel has some retinol
Yeah.
in it. So I put
Layers, you're
retinol
putting
in a
layers,
lot
yeah.
of things because more is better
Yeah.
to a certain extent. Okay.
Yeah.
But then when I add tretinoin, I add a 1% tretinoin. Okay.
Yeah.
Because my patients are already using enough that they've worked up to it. Okay.
Yeah.
It's like exercise. You don't just start running the marathon. You've
Yeah.
got to train to run the marathon. Your skin has to train. Okay.
Yeah.
And so then I put them on. I may start them on 1% every 5th night.
Mm-hmm.
Okay, because they don't want to peel either. Okay,
Yeah.
they don't want to be red, inflamed, or peel.
Yeah.
So I'll start them every 5th night for 3 weeks, 2-3 weeks.
Yeah.
Okay. Then I work them up to every 4th night, and then for skin like yours, in the summertime I keep you at every 4th night.
Okay.
Okay.
Because I don't want also, I think when people are on these regimes, they sometimes, sometimes if you start retinol for the first time, I think after 8 weeks, if you're doing that kind of tretinoid thing, you might sort of think, oh, I'm going to give up, because you feel your skin is dry, and that's why I love using your emu oil. But do you think that there's a breakthrough, and then after that, women's skin, if they just keep at it, they're not going to have that again, and their skin will have got used to it.
If you start slowly, you won't have that period, okay?
So that
and
everyone
what
needs
I
to
have
start slowly.
people do is they put all their skin products on, and then the tretinoid's the last product to apply.
Yeah.
Okay, so it's basically training, just like you were training for running the marathon or whatever sort of exercise. Okay, you work up to it, but instead of putting it on and peeling and going through all the misery,
and also instead of putting it on
slowly,
totally raw, clean skin, is what you're saying.
Right.
Do you think also, because I know what I believe in this, but I want to ask
first.
Yeah, but I want to know what you think, because I do vitamin C morning and night. But I will do vitamin C at night, and then I'll do retinol.
Okay, so truly, you should only use vitamin C in the daytime.
In the morning. Okay.
And the reason is because the body reacts to different ingredients at different times of the day. Okay?
okay.
So nighttime is repair.
So
So,
you
for
want to blend
instance,
the retinol,
my
yeah.
serum in the daytime is made to feed the skin what it needs, just like construction workers on a construction site. Okay?
Yeah.
At night, the night regeneration is the nighttime serum, and it's meant to feed the skin everything it needs to repair.
Yeah.
And the reason you use a retinol at night, number one, retinol is inactivated and has a bad chemical reaction with the sun. But number two is it's encouraging better repair.
Yeah, so
more
at night you have
energetic
more-
repair.
your body is using that signal better.
Right.
Yeah.
And so in the daytime, the skin's making collagen, okay? So you're feeding vitamin C to the skin because it uses vitamin C to make
help make
collagen.
collagen,
It's making hay while the grass is high. It forces more
Yeah.
collagen production.
Yeah.
But at night, it's only an antibiotic. So the only people I have use my vitamin C at night, okay, are the people who have acne or something that needs an antibiotic, because I use that as my antibiotic.
There you do.
Because remember, vitamin C, and this is why with people who have rosacea, you've got to calm the skin first. The skin's inflamed. Vitamin C is acidic on the surface of the skin, but it alkalinizes when it goes
underneath,
in.
yeah.
So if your skin
that
is
one,
already
yeah.
inflamed and you put vitamin C on before you calm it and heal it, it'll aggravate it at first. Okay, so you have to heal it at first. I mean, look, why do you not use inflammatory chemicals? It violates the barrier of the skin. The skin is meant to be acidic on the surface because bacteria, viruses, and fungus are hitting our skin all the time, and so it's what keeps us from getting things from getting in, keeps us from getting flesh-eating bacteria. So at night, you want to use things that are forcing. You don't want to make the skin run the marathon at night.
Yeah.
And that's what vitamin C does.
Yeah. I mean, I have one I use at night, but then I actually don't use yours. DCL Vitamin C Night Booster. So I do use that one at night if I'm doing a night one.
But
I
if
think
it's a
probably
liquid or cream,
it's
doesn't have that much. It's
Yeah,
exfoliating your skin to a certain extent. That's
probably.
all
I mean,
it's
it's
doing.
30%. It's quite a good one, I have to say.
Yeah.
They're really interesting, the formulators, and I
Right.
spoke to actually I have the
Right.
formulator for a while. But I generally am vitamin C in the morning. I mean,
Yeah.
a lot of people somehow say vitamin C is only at night, so I really try and say, look, I really advocate it in the morning.
It's only.
Okay, darling.
We should only be in the daytime.
Great. Okay,
So,
so,
to
where are we
go back
going
to
now?
what do
Yeah.
we do?
Yeah.
Okay.
Yeah.
So
I
look,
mean, pause and save in a moment.
Oh, we're
Yeah.
going to have a quick pause and save moment. Are people still interested to stay on? Okay, fine. Pause and save. The marathon. We have been going literally like a steam engine for probably an hour and a half. It's 11:30, 2 hours,
Yeah.
and we've discussed sugar, inflammation, vitamin C, retinol, water,
Rosacea.
constipation, menopause,
Ingredients.
hair loss, everything. So do watch the previous ones. Julia Hunter is a holistic dermatologist who's got phenomenal products and an amazing way that she deals with us internally and on the skin. And I love that approach. So we are at a stage now where it's having discussed.
It's
all
about
these
you.
things. It's about me, and it's
Right.
about what we will be doing. So I think we can all look in a mirror, and Julie said to me, look in a mirror, and I think probably the little scarring around here and my line. So we've discussed about the products of hers that I used on and off, and now I'm going to actually have a month intense just yours, because I've been testing so many things, so I always have to give them enough time to test them. So I'm definitely going to commit to that. But what else can we do today?
Okay, so also for lines, look, everybody has tried desperately to fill them in. The point is, what you want to do is if you stop the movement,
worse,
okay,
yeah.
that's Botox,
Yeah.
okay? Look, you try to stop the production of them by stimulating your skin to work at a more youthful level. And remember, that's not just the outside of your skin, that's also the inside, okay?
Yeah.
Because if you're not healthy inside, these are going to get worse. Your skin is thinning, because as we go down the path of life, what is the biggest problem? Our skin thins. You're starting with thicker skin, better thing, okay? People like me start with thinner skin, we begin to look like skeletons, okay? You keep the volume is the key, okay? And so, but still what happens is you're making all this movement, your skin can't keep up with the production, the vitamin C, the retin A, all those sort of things, tretinoin, all those things are making it better. Then what you go to is you're trying to exfoliate them off as well on the surface, okay? Then what you have to go to is stronger things, and that's Botox or technology. Okay.
Let's talk technology. I've done Botox here on these lines like probably every 6 months, because I have Botox probably every 5. No, I probably have Botox every 6 months now. Actually, I don't like to have it too much because I think I don't want my skin to get used to it. So what else when you say technology?
Okay, so basically then what you have to do is we don't call them lasers anymore because they're not really lasers because of the source. Most really good technology has a radio frequency source, okay? So what you do, what I'm doing, okay, and as far as what's out there, look, the microneedling is really good because you're forcing
all the time.
your growth factors. Okay?
And I do mine twice a week.
Right, and then I go to a laser like the Morpheus laser, okay, which basically has tips that have make little holes and discharge a massive amount of energy into the skin, okay, and it just forces new collagen production in such a monumental way, okay, that it rids these lines. Now,
how many treatments?
With Morpheus is what we call a big boy laser. In other words, you've got to numb people. You do one treatment, and maybe you do one treatment every couple of years. Okay. It depends on how people do it. Technology's only as good as the fastidiousness of the people who do it. Okay. The other thing that we're doing, which is available in the UK, just really coming into the US, which came out of Brazil, is carbon dioxide that you blow underneath the skin. Okay?
Why do you do that? I want to understand that. Has anyone heard of this carbon dioxide? So you're taking
carbon dioxide. Okay. So the same thing they used as the source to burn off your skin when you were younger. Okay. Basically, it's the same gas that you're blowing out of your lungs. Okay. That as you breathe in, look, a certain amount of the air is carbon dioxide. Okay. And so, what happens is you blow it underneath the skin, and the reason you do it, Brazilians started doing it probably 10 plus years ago because it helps get rid of cellulite. There's a reason they look so good in those little bikinis, but it turns on the stem cells. Okay, it forces, because it causes a massive vasodilation. Okay, and it's great for rosacea. P.S. Okay. And you blow it underneath the skin, and that's usually step one that we'll do.
Do you have that today?
Yeah, I've got it. I can do it.
Oh my God! Really?
Okay.
And does it show straight away?
So it takes a good week for it to kick in, and all of a sudden your skin gets this lovely glow. Okay. The sheen, basically.
What's the downside?
The only downside is when you blow it in, first it feels hot, feels cold, you feel pressure, okay, because you're blowing CO2 in there.
Yeah.
So it blows it up for a second. Like, for instance, if I go around and do people's whole face and neck, okay, as it blows around your eye, you see the eyelid blow up, okay? It swells up,
All right.
but only for like a minute,
Okay, fine.
and it's
Yeah.
pressure. When you're doing the cheeks, it'll go into here, and you feel this pressure. Some people, you can blow them up like the Michelin Man, and they don't say a word. Other people, it bothers them, okay? But I do it for the neck, for tightening the neck.
Yeah.
I mean, part of your issue is like
Yeah, yeah.
everybody,
Yeah.
the platysma,
Yeah.
this tiny little
Yeah.
little muscle, okay,
Yeah.
which is just, it's woven into the skin. It's just little muscle fibers
Yeah.
woven into the skin. Okay, it starts to fail. That's genetically determined.
I mean, I
And
do
some
do
people-
A-E-I-O-U, and that
Yeah.
U is that muscle.
Yeah.
U, isn't
Yeah.
it? U. I
Yeah.
tell you all to do this, ladies, but like it is the simplest thing,
Yeah.
and some of them might make you more liney, but I feel that all these muscles are holding
Because
everything
this
up here.
floor of your mouth,
You,
just
you,
like your
you.
pelvis falls and your bladder starts to fall out, okay, this floor of your mouth starts to fall, so you don't have the
support.
the support,
Yeah.
and it starts to fall. This sling that's underneath your tongue,
Yeah.
okay, starts to fall. It's just a muscle. But we can't weight lift that muscle, which is why I'm a microcurrent. I'm a great fan of microcurrent,
Yeah.
because what is it doing? It's helping to tighten that. The AEIOU
Yeah.
is doing the same thing, okay?
Yeah.
But the other thing it's doing, if you notice when you do it,
Yeah.
okay, is these strong muscles
These ones, yeah.
of the,
Yeah.
it's strengthening those.
Yeah.
And the reason we see those as we go down the path of life versus when we're younger is because our skin is thinning,
Yeah.
okay?
Yeah.
And so, I mean, look, you don't see them. You've got thick skin, but you start to see this in
Yeah,
everybody.
yeah.
Plus, you have a big vein that comes down here,
Yeah.
and it's darker. It's just like people start to talk about the dark spots around their eyes.
Yeah.
You've got a big vein that
Yeah.
runs down here,
Yeah.
okay? Right alongside that. So, that makes it appear worse than a lot of times
Okay.
it generally is. Okay, what else are we doing for that? So for this, products, internal
Maintenance of my products and my
Look,
microneedling.
The other thing that I put on people's, in the vein of your hormones,
Yeah.
is I put estriol,
I
as
have
you call
estriol.
it. Okay.
You put it on the face.
Okay, so I put it here on the face. It plumps up your skin
Yeah.
to the point that in a lot of people they're so deficient in estriol, and estriol is the estrogen of young women.
Yeah.
So it plumps up your skin some. I have my patients using it. Look, if they have dry vagina, I have them putting it in their vagina to
What, the
plump it
estriol
up.
or the testosterone?
Estriol, okay, because it makes lubrication again, okay,
Yeah.
and then they're putting it on their skin one day, they're putting it in their vagina one day.
Dry
okay?
vagina, can anyone identify?
Yeah, right, dry vagina, okay, a lot of people have it.
Mm.
And so, so estriol helps these too,
Yeah.
okay? Then comes technology. CO2 helps,
Yeah.
okay? And then we go to something like Morpheus, okay?
Do you have
Because
Morpheus here?
is the strongest one. I don't. When I come back, I'll have it here, okay?
When are you coming back?
I'm coming back in November.
Okay, so we need to try a Morpheus moment, don't we, ladies? So what would Morpheus
Morpheus
do? It's more long term.
So Morpheus, first of all, it's like maximal strength of micro needling, because
Okay.
micro needling you're just making little holes,
Yeah.
but you can't hurt yourself enough to really
Get the
Morpheus has a tip that it's all, the technology is very sophisticated. It discharges into the skin, the tip, which
Yeah.
is going much more deeply, and then it discharges this huge amount of energy, just a wave of energy,
Yeah.
which damages the collagen, okay, and forces a massive amount of new collagen production.
Yeah.
So it's going to revolumize your
Yeah.
skin.
Whereas
okay?
the carbon dioxide one that we're going to do
It's
now.
just thinning. The carbon dioxide, the one you had, thins the skin because it's controlled burn.
No, the one
But
you're
the one-
suggesting today.
It turns on it's a stronger, so versus skin products or microneedling, it's just a stronger production of collagen, and it's turning on those stem cells because
Okay.
your stem cells are trying to retire just like the rest of your body. And what you've got to do, whether it be with hormones, supplements, exercise,
Exactly. You've got to keep
got
working.
thyroid,
Yeah.
you've got growth hormone, you've got to keep them working
Yeah.
and making
Yeah.
daughter stem cells.
Yeah, and
okay?
make them believe that they're still in their working element of their life.
Absolutely.
It's tricking them in it.
Yes,
into
you've
it.
got to keep them working. Okay, now, the other thing you can do, because look, when people come in, I say, okay, we have to think about downtime,
Yeah.
okay? With CO2, there's no downtime except that, okay? Look, when I blow it around your eyes, do your eyes stay a little bit swollen for some people 24 hours?
Okay.
You won't notice it.
Yeah.
Other people won't notice it, but you'll notice it a little bit,
Yeah.
okay? And you can just put it in certain places.
Yeah.
The other thing I do, and when I was looking at your photos, is look, we always want to be anti-gravity,
Yeah,
okay?
yeah, yeah.
And one of the things that I do, and you may have had it done at the place where we met before,
Yeah.
is the Forma laser, okay? The Forma laser is no downtime,
Yeah.
but it's discharging, if you do it correctly, a massive amount of energy into the skin. It shrinks up the existing collagen,
Yeah.
and you've got more collagen because you have thicker skin, and it's
So
going
it
to force
tightens.
new collagen. It lifts, tightens, and one of the reasons I like to do it is I like to tighten around the eyes. I
Yeah.
like to pull this up. I like to pull everything up.
Yeah.
Okay, you can do it with CO2. A lot of times, what we'll do is because look, people come to me and they want to get a lot done at one time. A lot of times is we'll blow CO2 in there and then do the Forma laser
Yeah.
at the same time. Okay, takes a long time. Now there are people who are doing Forma laser who they do it for an hour. An hour, in my opinion, remember medicine's an art as well as a science. And I'm all about maximal strength.
Yeah.
And so when we do it, look, it takes us 3 hours to do your face, eyelids, and neck. Okay. It doesn't hurt. It's just goop. You know, you have to go around your entire face. Okay.
Okay.
But it pulls everything up.
Okay.
The CO2, if you've never done it, okay, how are you with when people do things to you?
Downtime is really low.
No,
Really
but
low.
as far as not downtime, but how do you tolerate things?
Oh, my pain threshold,
Yeah.
I have an incredible vanity. So my pain threshold is
It's
really
high.
high.
Yeah.
I mean, sometimes people don't use
Okay,
numbing
so
cream.
with CO2, okay, you basically, it's a tiny little meso needle
Yeah.
that you put it in,
Fine.
and look, as far as for hair loss,
Yeah.
one of the best things for hair loss now is CO2. We're blowing it in
We're
people's
going to do
hair
it. We're going to do that
all
today. Can
the
we do that?
time.
Okay, fine. We need to get started now.
Okay.
So, what I'm going to say is this: that I just want to finish off this segment.
Okay.
Say that I think what I love most about you. There's many things
Yeah.
I love about you, Julia. But what I love most about you is that we have some people who are just beginning to go to the local booths
Yeah.
and just get a skincare routine. We have some people who do a tremendous amount of things, and I probably sit in that I try a tremendous amount of things.
Right.
But you know, some people who join the channel later might say, yeah, but you know, if you do all these laser treatments and stuff, all the skincare you talk about is like irrelevant. And I'm like, the most important thing I can do that I've ever done is that I've had such a stringent, strict daily skincare routine. Irrelevant of the laser, irrelevant of all those lovely
Very important.
things.
Every
And
day.
I think that what I really value in how we talk today is the kind of daily holding up of your skin is so influenced by what you eat and by the kind of ingredients that's in your skincare. Separate to that, but as an add-on, is laser treatment, are other things that if you feel my budget allows it and I want to do more, they're available to you. But if you just
And they're
do
different price ranges.
and different price ranges,
Yeah.
and if you just do the eating better, the right supplements and the right ingredients on your skin, whoever you're going to, it's even just listening to what Julia's been talking about, it's about really looking at ingredients lists and saying how pure is that vitamin C, and you know, what's it diluted in, and just becoming more aware of what you're putting on your skin. And we discussed at the very, very beginning about organic versus clean and chirally correct. So that was a really great, interesting conversation at the very beginning. We've learned tremendous amounts today, and I just want to thank you anyway so much. And
I love to teach people.
And it was really, I think we've learned
To be
a
good
tremendous
consumers.
amount.
I mean,
Yeah.
because I hate to see people's trust betrayed.
I know, and it's you know, there's a lot of, in the beauty industry, there's so much, there's a high use of words, and a word I particularly dislike is anti-aging,
Right.
because I kind of, you know, I feel that I don't want to be defined by my age. That's the most important thing. I don't want to be defined by my age, and I want to have the energy that I need. So I like.
And you don't have to be defined by your age. I mean, I tell people
But
who
by
say,
saying,
"Oh, I've just
like,
turned 50." Who
anti-aging,
cares?
no, but I'm saying like anti-aging. It's like, I find it slightly insulting. Like when we were writing about some of our products, and somebody had written a copy anti-aging, I said, take it out. That's like,
Right.
no. SPF is, yeah, it's anti, but SPF is just protective.
It's an
Just a-
environmental shield.
It's an environmental
It's
shield.
what it is.
Okay, so we're going to go, and the next moment, if you do want to watch the next film, is I'm going to be having the CO2. No, I'm going to be having the carbon.
CO2,
I'm gonna
carbon
have this
dioxide.
Carbon dioxide around here and wherever else. Bye.